Well, hi everyone, this is Dr. Schroeder with this week's video introduction to week number 2 of our course in this introduction to nursing research and healthcare research. And a very nice week of discussion to sort of start off once we got our Blackboard issues worked on and once we got access and everything else. We did have the first full day of class. We really didn't have any Blackboard access. But once everybody got in and started discussion, they had a very nice discussion. And of course, this first week was this introduction to the concepts of the qualitative versus quantitative, the positivist versus the constructivist frameworks of nursing research. And most all nursing research falls into these two broad categories. Quantitative research is what we would sometimes consider hard research or that statistical numbers driven data research. And quantitative research is important and the only form of research that we can use anytime that we want to draw conclusions from what data means or try to find a cause-effect relationship. Anytime we're trying to see if one thing has an effect on another, if one nursing intervention has a more positive or has a negative outcome, compared with something else, the only way we can do that is through quantitative research. Qualitative research is much more open-ended and free-flowing. The goal of qualitative research isn't to try to find any cause-effect or correlational aspects between data, but just helps us to answer a question about what is it about? What phenomenon do we want to look at, and what can we gain? What information can we gain about that? Anytime we want to look at anything, values, attitudes, beliefs about something, how people feel about something, or how they perceive a particular phenomenon, that's the goal of qualitative research. And so we start with these two research articles. The first was the Beck study. The Beck study was a qualitative study looking at the lived experience of women who have post-traumatic stress disorder after childbirth. And this is a qualitative study, and most of you agreed that you thought that it was qualitative was probably the best way to look at this study, because it's really all that Kolkaba was doing is, what is these women's lives like? What are their perceptions? What do they think? She wasn't trying to draw any conclusions or any identity of what causes post-traumatic stress. Just what is the lived experience? What are some of the symptoms? What are some of the key factors? What are things that we can look at as similar themes? That's really what qualitative is all about, is identifying themes and what people say. What are some things that they say consistently? But remember, just because we identify themes doesn't mean that we can identify what causes those themes or what causes those attitudes. Can't really do that in qualitative research. That takes statistical analysis. The second article was the Beck study. The Beck study was looking at a very simple research question. Does a simple hand massage, lead to increased comfort in terminally ill patients that are receiving hospice care? A very simple study, and with a very straightforward premise. The premise is, or the question rather, is, does a very simple act of performing a hand massage lead patients that are terminally ill to have increased comfort? The goal of the study was to see if maybe this would be something to explore. Maybe this is a very simple procedure that unskilled, untrained, or non-professional caregivers could provide that would really help to increase comfort and show positive outcomes that way. Because that was the very straightforward reason for the study, that's why this study was done as a quantitative study. It wasn't qualitative. Many of you identified that you thought that it should have been viewed as a qualitative study. And if the research question was different, you would have been right. But because she was trying to see, is there a cause-effect relationship? It's very straightforward. She wasn't going to trying to go any deeper than that. Since that's what the research question was, that's why this was done as a quantitative study. And that's why there was a statistical analysis. And of course, the results of the study essentially showed that in kind of the brief answer is that there really isn't a correlation. There really isn't anything to show that hand massage, increases comfort, at least not in this very small sample of a study. That's why she didn't take it any further, and that's why there was one reason why there was no qualitative aspect of it. There are other reasons why I'm sure she didn't do a qualitative a portion or a qualitative aspect of this study as well. But the bottom line is that since there really is no reason to believe that hand massage leads to increased comfort, then there's really no need to try to delve into the reasons why or the attitudes that the patients had. That might be an interesting study that could be used to generate another study. But for this particular study, to answer that question, it wasn't necessary. That's why it was done as a quantitative study. So again, that's kind of really the important takeaway from this week, is to understand the various parameters, and that what drives a study methodology isn't the topic or isn't the subjectivity of it. It's what are we looking to show? Are we trying to show that there's a cause effect or a correlational aspect? Are we trying to count numbers or trying to quantify behaviors or a subjective experience to try to see if there's a cause-effect relationship? Or are we just looking to see, what do people think? How do people feel? What are your attitudes about something? Those are the two general types of study that we'll be looking at. And so we use that as a jumping off into week number 2. In week number 2, we'll talk a little bit about the IRB process, or excuse me, not the IRB process, a little bit about the different sources of literature, and talk about peer-reviewed and what does peer-reviewed mean, and focus a little bit on the various databases. Almost all nursing literature and all peer-reviewed literature is found in either PubMed or CINAHL. CINAHL is an acronym that stands for the Cumulative Index of Nursing and Allied Health Literature. Virtually all nursing journals and all nursing literature is published in that particular database. So you're going to talk a little bit about the databases as the first part of the question. And then you're going to post a research question. You're going to identify a problem, where you're going to identify a research question related to some aspect of nursing science, and then write a research question identifying if you would use a qualitative or quantitative reasoning. And again, remember, it's the way that you word the research question is what is it that you're trying to find. If you're trying to seek a cause-effect relationship or see if one thing affects another, that's quantitative. If you're trying to just see what is it, trying to find trying to find out more about a specific phenomenon, then it falls into more of a qualitative realm. Mixed methods is something that we'll touch upon later. Mixed methods is where you're really it's not you're combining methods necessarily, but you're doing qualitative and quantitative at the same time, essentially answering two specific research questions. We'll talk about that a little bit later though. So that pretty much wraps up our week. No written assignments due this week. Again, in another couple weeks you have a exam or a quiz coming up, and so be aware of that. And then we'll talk about the written assignments starting a little bit more next week. But this week, primarily the discussion question responses. I look forward to seeing you in the discussion questions. I'll be participating along with you, and so everybody have a great week, and I'll see you in the discussion forums.